I'm VJ Hamilton, and welcome to the Autoimmune RESET, the place for you to learn how to thrive with autoimmune disease and feel empowered to take steps to transform your health to feel better than ever. You can start making changes today to improve your health. So with every episode, my mission is to share with you simple ways to up-level your diet and lifestyle, with key learnings from my own journey reversing autoimmune disease and inspirational stories from those who have reset their autoimmune symptoms and are now thriving in life. I suffered from autoimmune disease for over 25 years and now I live symptom-free, and I wish the same for you as well. So thank you for being here and sharing this time with me. Now let's get started. Hello and welcome to the Autoimmune RESET podcast. I'm your host, VJ Hamilton. I'm a nutritionist, scientist, and expert in autoimmune disease. And today I'm very excited to welcome Dr. Fionnuala Barton to the podcast. Dr. Fionnuala is a private GP, a women's health doctor, and an accredited specialist doctor with the British Menopause Society. And today that's what we will be talking about. So I'm excited to really cover all the myths, HRT, and some natural therapies for menopause and perimenopause. But Fionnuala, I'd love you to talk a bit more about what you do. I know most people know you as the Menopause Medic, and so love to hear from you a bit more about your background, how you help people, and then we can get into some questions.
Okay. Well, thank you for having me on the podcast. It's been a long time in the planning, so I'm thrilled to finally be here. And yeah, we met at a speaking event, didn't we, a long time ago, and actually just really realised that we're both kind of approaching these issues from a very similar holistic perspective. And I think that's where I'll start in terms of, what do I do? So yes, I'm a medical doctor. I've since subspecialised in women's health, and in particular focusing on evidence-based but really holistic care for women going through perimenopause and menopause, and proactively identifying and proactively treating symptoms to help women feel their best through their midlife years, but also to optimize their health and well-being in the long term. Utilizing the power of hormone therapy and pharmacological treatments, but also not ignoring the really valuable non-pharmacological strategies that can be so important and almost sometimes more important to support our health and well-being at this stage. So I practice privately now via my online platform, the Menopause Medic. I offer virtual appointments and in-person appointments here in Hertfordshire, and then try as often as I can to do some education and empowerment work via my social media channels. It's my creative outlet. So at the minute when things are really busy, I've not had much time to spend over there, but I hope to have more time there in the next few weeks and months.
Yeah, it's an amazing outlet. So anybody that hasn't seen the Menopause Medic on Instagram, there is just so many helpful videos that you share and insights, and I love watching them as well. When I have guests on the podcast, I like to know, and a lot of the time I'm having guests that have had a chronic illness or autoimmune disease, but actually it's great to hear from you why you decided to specialize in this particular area, and why you decided to become a doctor, because a lot of us are, we don't know what we want to do when we're quite young, but did you always have a calling to help people and to become a doctor?
Do you know what? I always loved science and I always loved kind of medicine stuff. My mum will joke that my favourite first book was a book called Blood and Plasters, this tiny weeny like hardback, kids book. And it was all about a little girl who falls over and grazes her knee, and it described what happens, when you have a graze and what happens to heal that graze, and then you put a plaster on and you heal and all of these sort of things. And it was my absolute favourite book. I used to read it like several times a day. And then I absolutely loved science, and so it just felt like a really natural choice to go to medical school and to train to be a doctor, because I think I've always had a very strong calling towards helping other people. I love spending time with people, and the combination of the two seemed like a natural choice and progression. And likewise, I loved general practice. I didn't really know which speciality I wanted to enter after my training was complete. So it felt like a kind of logical thing to try general practice, where actually you have to know quite a bit about most things, and you have really strong connections and relationships with your patients. Well, certainly that was the case when I trained as a GP. I think it's slightly different now. But I always had a real focus on women's health, having, experienced women's health issues myself, from menstrual health issues to fertility or pregnancy. And actually watching my mum's experience of menopause was a really galvanizing one for me. So that happened around the same time I was at university when the Million Women study was published.
Okay.
And the Million Women study, for those who don't know, was a huge research project that was an international project with centres all over the world that was essentially following the lives of 1 million women who were using HRT or not using HRT. And it was the study, parts of the study were stopped early in about 2001 because some of the scientists released some data that indicated that hormone replacement therapy, as it was prescribed back then, may increase risk of certain diseases like breast cancer and stroke. And so there was a whole generation of women who were denied HRT. The HRT was stopped. And they had then had to sort of, cope with the difficulties of their menopause without that key medical approach. And sadly, my mum was one of them. I was going through medical school. I remember vividly being taught that HRT was harmful and we ought not to start it unless it was absolutely necessary. But then in my career as a general practitioner, I remember coming across countless women who just had, multi-system symptoms. They had problems in lots of different parts of their bodies, and no one was able to kind of add them up and find a solution. They were going for cardiology testing, neurological testing, gastroenterological testing. They were having skin tests. They were having eye tests. They were seeing the gynecologist for their abnormal bleeding, and there was nothing kind of tying it all together. And I remember having a real light bulb moment at a conference. I heard Louise Newson speaking. And
Okay.
I reflected, I was like, all these women that I've been seeing, this is what's going on. And they were all in that midlife women cohort. And actually, then that was when I really decided that I was going to subspecialize in the care of specifically perimenopause and menopause women's health. And it's been full steam ahead since then. I entered perimenopause myself, so I'm actually going through it, as are, I think, so many of my friends and family. And so have got a real personal kind of viewpoint to bring to things. And I suppose I kind of see myself as a little guinea pig. I'm trying and testing a lot of things along the way and sharing that as part of my journey.
Yeah, I think I love that about, the way that you can help people and you can actually help yourself a lot of the time because when you're helping people with similar issues, and I'm working a lot more with perimenopause and menopause now, and it's just great because I can be proactive with it too. Because, it is that time of life and it is, I think being proactive around the perimenopause and menopause is so important. But when it comes to menopause, what do you think are the biggest misconceptions that you see at the moment around HRT, but also just menopause generally?
Yeah, so I still think there is a kind of a misunderstanding that menopause is something that only happens to older people. And yes, absolutely. The majority of people will experience menopause in their 50s. And menopause is defined as the point at which you haven't had a natural cycle for 12 months. Your ovarian reserve has, been exhausted and you're no longer reproductively, capable. So I think a lot of people think about these symptoms and problems affecting them in their 50s and beyond, but actually what I think we're learning more and more about is this relatively ill-defined phase called the perimenopause, which is the run-up to that point of menopause when our ovarian reserve is declining, sometimes quite chaotically, sometimes quite rapidly, but always progressively. And actually that can start from up to 10 to 15 years before your expected time of menopause. And so it's something that we should be focusing on from about our mid-30s and beyond, when, of course, we know our fertility starts to decline quite dramatically. And it stands to reason that, if our fertility is declining in our mid-30s because our ovarian reserve is low, we're also going to start to experience some of the perhaps symptoms, but also sort of silent biological changes that happen when our ovarian reserve is low and we're not producing as much estrogen and testosterone and progesterone with each of our menstrual cycles. So that's one of my big kind of myths. Menopause is only something that involves women in their 50s and beyond. Actually, it's something that's relevant to younger people, but also premature ovarian insufficiency, or what used to be called premature menopause, can affect anybody at any age. And actually, statistics would suggest that sort of 1 in 100 women under the age of 40 40, and 1 in 1,000 women under the age of 30 experience a premature menopause. So this is a lot of women who are potentially being missed. They're going to their doctors, they're saying, I've got these symptoms, my periods have stopped, I'm worried that I'm going through this, and they're potentially sometimes being ignored. And it's really important that we pick up those younger women, because if you've lived a prolonged period of time in your years below the age of 50 without sufficient estrogen circulating, that has a significant increase in risk for things like your bone mineral density, your metabolic health, and your cardiovascular health risk. So proactively picking that up, making sure that women feel heard, feel seen, and can then feel empowered to talk to their healthcare professionals about that is something that I'm really passionate about. But I think one of the other myths is that HRT is dangerous, and actually I kind of referred to that earlier with the Million Women study. And what I think is important to bear in mind is that since that study was published, the authors of or the researchers who undertook the study have actually been open about the fact that the data was misinterpreted and misreported, and that actually cohorts that were in the study have continued on their HRT, and there have been countless research studies that have been longitudinal and very high quality research studies since that haven't found that same association in the same strength that the Million Women study did. And there were a couple of big confounding factors with that study. There were older women generally taking older forms of HRT, so synthetic forms of HRT, which we know even now do potentially carry a slightly increased risk of breast cancer associated with their use. But nowadays, the HRT that we have available, we most commonly will prescribe something called body identical HRT. This is hormone therapy or medicine that is produced and developed by pharmaceutical companies, that is it's not natural, it's a synthetic product, it's a medicine, but within those medicines they contain molecules that are identical in nature to the molecules that our ovaries make, so the estradiol and the progesterone and the testosterone molecules that our ovaries make. And so in that respect, they're kind of directly mimicking what our natural hormones would be doing. And in studies, these have been shown to be significantly safer and lower risk than some of the older, more sort of synthetic hormones that were not not molecularly the same as our natural hormones. I think that that's a big change, and that people are still really scared of HRT and breast cancer, and I completely understand that. I mean, breast cancer is something that is on the rise. Increasing numbers of younger women experiencing breast cancer, and no one wants to go through that. I think most of us have got a friend or a family member who've gone through a breast cancer diagnosis, and if you want to avoid that, then kind of burying your head in the sand and ignoring the idea of HRT is actually completely logical. But I suppose what I want as many women to know as possible is actually, for the vast majority of women, hormone replacement therapy is a very safe but also the most effective treatment for symptoms in perimenopause and menopause. But not just that, health prevention in terms of reducing the risk of bone problems, metabolic problems, and cardiovascular problems that can manifest later in life because of low ovarian hormones after menopause. So they're probably the two biggest ones, sort of age of onset and hormone therapy reluctance or hesitancy, really.
Okay, well, there's loads there. Wow, that just, there was so much information in what you just said. I mean, to start with, the being proactive around symptoms, I think this is so key, isn't it? And I think that actually ties into the HRT as well, because when you're more aware of your symptoms and you can almost understand whether you are in perimenopause or menopause, then you can make decisions around HRT. So what would you say in terms of symptoms somebody should be looking for, and when should somebody be looking for them? Because as you said, it can happen to you at any age. So what are the more obvious symptoms that somebody might think, actually, this could be to do with hormonal imbalance, and maybe I need to start looking into that and speaking to my doctor about that?
Well, my answer to that is that we should all be thinking about, and we should all have an increased awareness of what experiences we have that may relate in some way to our underlying biological changes. And this is something that's relevant to, young girls pre-pubertally. It's relevant to young girls who are going through puberty, who are starting their periods, to younger women who are having periods but perhaps having other hormonal symptoms. I think it's really important for us all to really tune in and start listening and recognizing some of the signals that our body is giving us, because actually, our body is giving us a lot of information with our menstrual cycles. On a really simplistic basis, if our periods stop, that is a signal that there is something significant going on, whatever age or stage you're at.
Yeah.
But if periods are longer, if they're later, if there's other symptoms associated with menstruation, then all of that can point to hormonal disruption or something that may need some investigation and proactive treatment associated with it. So, but in the context of perimenopause and menopause, I think that, thinking about your menstrual cycle, or recognizing if you start to experience changes in your menstrual cycle is probably the most obvious one.
Yeah.
And it may not be that your periods stop, because that's often a very late symptom in perimenopause and menopause. But, if your cycle length is changing, if your flow is changing, if you're having shorter, lighter periods, if they're going longer and longer between periods, these can all be signs that actually your natural menstrual cycle is changing because your ovarian reserve is declining. Similarly, if you're struggling to conceive, so if you're in your 30s or early 40s, you're trying desperately to conceive, and actually it's fundamentally difficult. If you're having investigations and you've been told you have unexplained infertility, it may just be that you're already in perimenopause. And actually, thinking about what other symptoms might also be, contributing to, or what other symptoms might indicate, early perimenopause. For the vast majority of women, actually periods will stay pretty stable, but it's sometimes more subtle and non-specific things that will start to change. So a sense of anxiety, increased
Yeah.
overwhelm, some cognitive change, sleep disruption, skin changes, the sort of dryness, irritation, hair changes sometimes, so sort of hair loss symptoms, thinning, more dropping from the hair, widespread joint aches and pains, increased susceptibility to injury or prolonged recovery from injury, vaginal discomfort, vaginal dryness, bladder symptoms, so urgency, frequency, having to wake at night all the time to pass urine. A loss of libido is actually often a very early sign, when testosterone levels start to kind of deplete, and estradiol levels start to deplete. It can really impact our motivation, our drive, and our desire, specifically in the context of intimacy and sexual relationships, but also more generally, we can feel more apathetic, we can lose interest in things, we can be less motivated to do and enjoy the things that we've spent time enjoying in the past. And some of this, and most of it in perimenopause, will creep up quite insidiously. It won't be that one day you wake up and all of these symptoms have arrived. It's that they sort of creep in, which is why it makes it quite difficult to diagnose. The classics, mood swings, night sweats, daytime
Yeah.
flushing, they're often actually kind of a little bit later on down the line. So it's the subtle stuff that, just doesn't feel like you and doesn't align with who you are. And that goes back to that point earlier of tuning in, because I think if we really understand who we are, then we're much more likely to pick up when something even subtle is changing.
Yeah, definitely. And I mean, I quite like health gadgets and I do a lot of journaling. Is there any way that you would recommend somebody is able to check in with their health a bit more and check their cycles? Is there a favorite app you use or favorite device?
Yeah. So, I mean, this is probably a slight overshare. I've got a Mirena in, so I haven't had a period for 11 odd years.
Okay.
So I don't use the tracking app. I probably should, because I do have cyclical symptoms, even though I don't have periods. But I've recommended things like the Clue app in the past. Louise Newson's got a really great app called the Balance app. And you can log your menstrual cycles, but you can also sort of log any other symptoms. So I know with Clue, you can, log if you felt hot, if you've both felt exhausted, if you've felt more emotional or more tearful, and what then you get is a kind of a chart which you can look back on and say, well, when was I getting these symptoms? Was it throughout the whole cycle? Was it just in the few days before my period? Was it for 5 to 10 days before my period? Is this something that is now becoming a significant problem? And actually, this is something that I hear in clinic quite a lot in my younger sort of perimenopausal patients. They'll say, I've got a bit of PMS, but, I used to have 3 weeks of my cycle where I felt absolutely great and a week where things weren't great. But now I'm in a situation where 3 weeks feel absolutely awful and I've only got 1 week where I feel in any way normal. And that's not okay. That's not necessary. You don't
Yeah.
need to live life like that. And as I said at the very top, hormone therapy can be really helpful in these situations, but so too can a load of lifestyle changes, but you can't make those changes unless you recognize what it is that's going on. So tracking is a really useful way of just keeping in touch with, that ownership over it, really. In terms of other tech, yeah, you can sort of look at things like your sleep cycles. Often your sleep quality and REM quantity will change across your cycle, and that may be then negatively impacting how you're feeling in the daytime. If you're not getting any REM sleep because you're deep in your luteal phase for 2 weeks out of every month, then you're going to be more irritable. You are going to have more mood swings. You are going to be able to concentrate less and have a little bit more problems with, cognitive function and whatnot. So actually, that is a really useful thing as well to track, and to try and optimize as much as possible. But aside from that, there wouldn't necessarily be anything else that I say people have to do. So keeping it quite simple, I think, is probably the best thing.
Just because you mentioned it on the Marina coil, or if somebody does have a coil, then what symptoms should they be looking for, or is it just using an app like you mentioned and tracking symptoms and seeing the cyclical nature of it? Is that the best way for them to understand what
Yeah.
their symptoms might relate to?
Yeah, so I mean, a lot of people, about a third of women with Mirena will still have a bleed on a cyclical basis anyway. So Mirena doesn't stop ovulation; it just prevents bleeding by its mechanism of action, suppressing the womb lining from getting thick. And so you still have your cycle in the background, and some women will still have a slight bleed or a normal bleed, but the majority of women will stop bleeding completely with a Mirena. But you will still potentially notice cyclical changes, and if you're alert to it, and if you're already in the habit of tracking, then you might notice if actually you're having prolonged spells where actually you've got lots of symptoms and only minimal spells where you're feeling normal and like yourself again. And again, it's quite nice if you can plot that and look back at it. But actually, it's not always that easy. Let's be absolutely honest. This is happening to women at a stage of life where we're at our absolute busiest. We're
Yeah.
being pulled, stretched, and pushed and whatnot in all manner of different directions. Our priorities are often with other people, in the workplace, with family members, with partners, with children. We're on a million WhatsApp groups. We've got social media channels firing information at us from everywhere. We're spinning a lot of plates. And tracking our symptoms and tuning in and being intuitive can often be one of the last things that we're actually prioritizing. And so sometimes it's just maybe taking a pause every so often. And if you're feeling not good, using that as an opportunity to say, well, what is it that's going on? And
Yeah.
could this be due to something else? The other thing I hear in my clinic a lot is, this has been going on for years, but I just thought it was due to stress. I just thought it was because my kids didn't sleep. I thought it was because work was really stressful, or I thought it was because I was grieving. And
Yeah.
often all of these other things are going on in the background, but it's likely that there is also a biological component to it too. So just actually listening again, if things are feeling really uncomfortable, pause, maybe think about what you're experiencing and reflect on whether that is something that might actually be biological as well as circumstantial.
One of the symptoms that I see a lot with my clients is they will come to me in and you've already mentioned it, but the night sweats become unbearable, or just sweating generally. What is your approach to that? I know it's going to be individualized and personalized, but what do you often find is the underlying issue with the night sweats?
Yeah, the predominant issue with the night sweats and the daytime flushing, but also the cold shivers and shakes. So a lot of people will, rather than feeling hot and sweaty, they'll get intractably cold in the same way that when we've got like hypothyroidism, you just can't get warm.
Yeah.
So I think first of all, you need to make sure there isn't anything else going on. You need to make sure you screen for whether that person has, another cause for these symptoms, like an abnormal thyroid, or indeed an undiagnosed blood disorder or infection, or any of these things. But then if actually we've ruled out that it isn't anything else serious that's sort of reversible or treatable, then the reason it's likely to be happening is because although we think about menopause and perimenopause as being a really gynecological issue because the primary change is ovarian reserve and ovarian hormone production, actually, so many of the symptoms in perimenopause and menopause are actually symptoms from our central nervous system, because those three really important ovarian hormones exert really powerful regulatory effect on our central nervous system, the part of our brain that regulates our temperature, which is incredibly sensitive to any kind of changes in ambient temperature and relies on this kind of really steady state of ovarian hormone production to maintain that normal thermostatic control, essentially. So as soon as our hormones start to fluctuate, we can start to experience a change in that internal thermostat in our brain, and that is what then manifests as an abnormal response to to ambient temperatures. So either feeling very hot and flushing to kind of compensate for your body's perceived temperature, or cold and shivering because your body has perceived the temperature to be different to what it is. And hormone therapy is amazing at treating this, and actually it can be night and day. So I've had patients who come in, they're having flushes sort of 10 times a day, they're sweating through the night, they're not sleeping, and we start them on hormone therapy, and within a couple of days they're not having any night sweats or flushes anymore. And that's because we're giving the hormones back that are then stimulating that central nervous system pathway much more reliably. But if hormone therapy isn't something that is an option for whatever reason, because somebody doesn't want to take it or somebody cannot take it because of the risks,
Yeah.
then there are other pharmacological options. So actually a couple of the antidepressant medications, so fluoxetine, which is commonly called Prozac, and another one called paroxetine, and a third one called venlafaxine, which is a slightly different antidepressant. These three have been shown in clinical trials to really significantly reduce frequency of hot flushes and sweats, and have now been licensed for the treatment of these vasomotor symptoms in menopause. So, and they are incredibly, helpful. Again, I've had patients who've gone through breast cancer who can't have HRT, who are flushing and desperate, and actually they start on these medications and it allows them to sleep again, which can be enormously helpful and beneficial. There was also a new drug that was developed, a non-hormonal drug that was developed and licensed fairly recently called Veoza. And this works on that sort of central thermostatic mechanism in the brain via a slightly different pathway to help regulate temperature control. And I haven't got many women using it, but I've got a couple of people using it who have found that completely transformative in terms of alleviating sweats and flushes. And if that is the only symptomology,
Yeah.
focusing treatment on that can be really beneficial. Aside from that, looking at lifestyle strategies to try and help to support normal circadian rhythm and normal, regulatory function within the central nervous system. And it sounds trite, but making sure that you're not overwhelmed with stress, which is going to heighten your central nervous system responses to various different things. Thinking about how you can control your body temperature. So a little thing might be actually having a bath or shower before bed that's actually quite warm, because actually if you increase your core body temperature just before you get into bed and then you get into a cooler bed, you're then going to have a much more even sleep, and you may help to sort of reset that thermostat internally. Making sure you've got ventilation in your bedroom, you've got like bedding that is comfortable for you to sleep in, that you're not having to sort of kick off and throw on and kick off and throw on all the time. Breathable nightwear and sleepwear and things like that can often be really helpful. And exercise. So these flushes and sweats are a vasomotor symptom. And what I mean by that is it's your blood vessels dilating and constricting that's giving rise to this symptomology. And so actually being in good cardiovascular health can really help to reduce the severity of those symptoms. So making sure that you're exercising on a regular basis, exerting yourself, you're getting your 5 episodes of 30 minutes of vigorous activity that is the kind of baseline that we should all be aiming for to maintain a healthy cardiovascular system. And then there are some nutritional supplements which can really help. So things like black cohosh and red clover have been shown in studies to be really helpful for hot flushes. But you have to be really careful if you are not allowed to use HRT for whatever reason because of a previous diagnosis, then please do check with your doctor before taking those herbal supplements.
Yeah, because they can be extremely effective in the body. And I think people just see supplements slightly different to medications, but they can have contraindications and issues as well.
Yeah.
So let's definitely always take a practitioner's advice. But these are great tips, and I don't love this, because when somebody's having these types of symptoms, it's awful to be going through this. But actually, when you're looking at the ways and the natural therapies and the medications to help with it, especially having a bath before bed, I'll often recommend that. But people are so motivated when they know the reason for doing
Yeah.
it. Particular symptom. And the exercise point, I remember when I was 18, I was going to to do exercise and running to get fit. Now I'm thinking about my brain, when I go out running. And I just think it's so much more motivating when you have have that in mind. Well, we've gone through so much today. Loved having you finally as a podcast guest. I know we've been talking about it for an awfully long time, and we've done a few Instagram lives, haven't we, as well? So if people want to go have a look at those, you can either go over to my Instagram account, or you can go over to the Menopause Medic Instagram account, and check everything out there. But if somebody is going through these symptoms and is in perimenopause or menopause and is looking for support, obviously they can go over to your Instagram account. But where should they start looking in the first instance?
So I think this is a really important point, because one of the great things in the last 5 or so years is that we've seen an absolute explosion in the amount of information available for, women experiencing menopause and perimenopause. The downside of that is you have to be quite discerning about where you seek your information, because not all of it is correct. And actually, I see in clinic a lot of people will say, well, I've read this and I've read this, and they're completely conflicting. What do I believe? And I think it's then really important to make sure that if you've read something from anywhere, that you fact check it. And actually, if somebody's making a claim that sort of feels quite too good to be true, then maybe it is. But look at their references, look at whether the scientific data that they're quoting or talking about is from a peer-reviewed kind of high-end scientific journal or paper. And if that isn't possible, then maybe go to Women's Health Concern. So Women's Health Concern is the patient arm of the British Menopause Society. And actually the British Menopause Society, or the BMS, have got some really lovely patient information videos now available that you can just watch on their website, and I think via their YouTube channels. So if you want to double check something, maybe jump onto the BMS website or go onto the Women's Health Concern website, and you should then be able to double check whether what you're reading in another source is actually true and factual and evidence-based and supported by, the wider sort of accredited scientific community on menopause. In the States, you'd look at the American Menopause Association, and they have a journal called Menopause. And I'd say that's probably what I would suggest in the first instance. So go to those organisations, because their information is going to be fact-checked, is going to be evidence-based, and is going to be, high-end quality. But equally, there's a lot of stuff that we don't yet understand. I'd love to say that, the evidence base for women's health is, at the pinnacle, but it's not. We are catching up. There is so much that we don't yet know about women's health and that we don't yet understand. There's not enough funding into women's health research, and actually, in terms of the proportion of that funding that goes into menopause and perimenopause, it is galling how small the proportion is, given that this is going to affect directly 50% of the population, and the other 50% of the population are experiencing things indirectly. So, there might be things coming out that are new, that are actually exciting and haven't got a huge evidence base because they haven't been studied robustly yet. So, take it all in, be discerning, fact check if you can, is what I would say. And actually, what a lot of people find beneficial is actually having a conversation with another human being and saying, is this true? Is this true? What should I do specific for me? And actually, increasingly, I'm finding that's what I'm doing often in clinic. People kind of know what they want, but they just need clarity, and they need certainty, and they need to collaborate on a plan that is going to be best for their individual needs. So if that's what you're looking for, then obviously, get in touch. And if you're in the UK, hopefully I can help. If you're in the US, there's a whole bunch of great clinicians that are offering similar services over there, and similarly in Australia. And if you look at your local menopause association, there's normally a postcode search for somebody who's accredited that you can book in and see. So that's what I would suggest as a first off. But I think, trust your instincts. Is what I would say. I remember when I was experiencing my first symptoms, even though I was a doctor and I was aware of what was going on and what might happen, I still didn't trust myself. And I went to see several doctors, and several doctors told me I was too young and it was all in my head and blah, blah, blah. And I finally saw a clinician who really believed me, and they did all that was necessary in terms of testing. And they said, do you know what? I think you just need to start some estrogen. And it was night and day. Within a few days, I felt like myself again, and it was tremendous because I've got my Mirena, so I didn't need any additional progesterone as well. And so I would say my learning point from that, and one of the things that I'm most passionate about for all women, is you more than anybody else knows you, and you need to trust your instincts about what's happening to you. And if you aren't getting the answers you need when you're asking those questions, then ask somebody else and keep asking until you feel more like yourself again.
Yeah, this is such great advice. And those organizations that you mentioned, I will link to. But also, where can people find you? Where's the best place to reach out to you if people want to, understand a bit more about your services or read a bit more information about how you might be able to help?
Yeah, so I think the easiest thing to do would be to go to my website, which is www.themenopausemedic.com. And there's information about what we offer, how to access it. You can book directly online from the website, so you don't even need to pick up the phone or look in, via email. You can just click a link and you can see if there's a spot in the diary that you want and you can book in, which for me was really important because having open access to that without there being additional barriers in the way was really important as somebody who hates having the palaver of having to book things when it's more, it's more
I know, I'm
complicated.
completely with you.
Yeah. So yeah, that would the website would be best. And if you can't remember that, then finding me on Instagram is fine. You can DM me via Instagram and I can direct you accordingly if needed. But yeah, it's been an absolute pleasure. Thank you, Victoria.
Yeah, thanks so much, Fionnuala. And I'm sure, well, I would love to have you back on because we've only covered about a fraction of the questions I wanted to ask you. So hope to speak to you again, and I'm sure we'll do other things together in the future. And thanks again. And yeah, have a great rest of your day.
You too. Take care. Bye bye.
Thank you very much for joining me today on the Autoimmune Reset. I really hope you enjoyed the discussion, and be sure to subscribe to the podcast so that you never miss an episode. And if you liked it, I would hugely appreciate a review on iTunes, as it helps me understand what you like about the podcast and to help share the information with more people. I'm excited to speak to you next time, and remember, you have the power to take the reins on your health. So keep the faith and celebrate the small wins. Until next time.